I'm Laura Cooley. I'm the host for this patient experience virtual interactive series. This is part of our series to support previews of the Patient Experience Symposium, which is happening in person in Boston, September 16th through the 18th. So we're delighted that you're here live with us for this virtual preview. I can't wait to introduce you to our featured guest today, and we'll preview her live appearance that will happen on September 18th in just a moment. So we hope you're joining us. We're really grateful to have several sponsors and several others coming on that are supporting the event to help make it a success for us all. And one preview for the event in Boston in September is our theme, which is nurturing progress, planting the seeds of change. We all know that healthcare is constantly changing, and with patient experience, our goal in September is to think about how we can fertilize the soil so that we can plant healthy seeds that grow and really lead to transformation in a way that is sustainable and good for us all. And at this event, you'll see a lot of impressive speakers, evidence-based presentations to really give you something to hold on to. Interaction is important, as it is today. We'll have interactive moments throughout the Patient Experience Symposium in September, including facilitated roundtables where there will be a host to help anchor meaningful discussions with participants and build connections. And I'm also excited about our primary care track. We have a special feature to make sure that we're thinking about ambulatory care, primary care, as well as the larger kind of hospital clinic system standpoint. So I hope to see many of you in Boston. Without further ado, I am very excited about our featured guest today. And you may already know something about her because she has quite a presence in the field, Dr. Geeta Nayyar, MD. And she told me that I could call her Dr. G, which I think a lot of people do. So I am delighted to spotlight her during our conversation moving forward. And as she prepares to introduce herself, I'm going to invite her to tell us more about her identity and how it connects to patient experience. But you should know first that she has an awesome book out called Dead Wrong, Diagnosing and Treating Healthcare's Misinformation Illness. I'm sure we'll hear a little bit about that today. People who register for the Patient Experience Symposium can request their free copy, which they'll get on site. And for coming today as a participant, you also can get a free copy. So we'll be sure to correspond with you if you'd like to be sure you claim that. So as we move into our featured guest interview, I want to forecast that at about the 40-minute mark, so 20 minutes from now, we'll transition to interactive discussions where you as participants get a chance to talk about today's topic on artificial intelligence, innovation, and a human approach to healthcare. So without further ado, Dr. G, welcome. I'd love to invite you to start with how you want to describe your own professional identity, especially as it connects to patient experience.
Sure. Well, first of all, Laura, thank you so much for having me. I'm super excited to join you and the team at the Patient Experience Symposium in the fall. And gosh, I think my journey is really as a physician, as a patient advocate, and as someone who really saw the promise of what technology can and can't do from the earliest era of the beginning of the EHR to all the fun and exciting tools and technologies we have today, like artificial intelligence. But I would say first and foremost, I am definitely a physician and really in it for the patient care and for what ultimately should be a good patient experience. So really thrilled to be with you.
Well, thank you. And, I know that you've worked with a lot of large tech companies, which I've always found to be fascinating as someone who came from trained as a doctor. I'm not sure, but I think you recently have still been seeing patients. And then you made this leap to really get into the business side of healthcare. So I'm just curious to know a little bit more about your identity and what it was like for you to make that leap, and maybe how you thought that would impact patient experience.
You bet. I ended up in tech very much as an accident, and depending on who you ask or how you look at it, it was either being in the wrong place at the wrong time or the right place at the right time. But really, my generation of physicians went from paper to digital in our residency, in our training. And so I saw really firsthand what the things were that we could do on paper and what the promise and the opportunities would be with tech. And so much of it, we're still realizing today, right? So much of the promise of technology has been tremendous with regards to analytics, documentation, virtual health, which we saw come to real life during the pandemic. But we also lost a lot of what we had before, which was the better bedside, the eye contact, the meaningful note, not just a note, right? And when we extend that to where we are with artificial intelligence, social media, the consumer who has healthcare on their proverbial wrist, their proverbial finger, right? When we think about wearables and all the different things that have changed with patient experience, that's exactly right. And really where where I get my kicks is really at the intersection of business, medicine, and tech. And being a physician who can connect those dots, ultimately, we have to remember that technology is here to move humanity forward. Healthcare, the experience of being a patient, being a consumer is the business of humanity. And so how do you do all of those things that need to be done, but would still maintain that humanity and still maintain the patient at the center? And also remember that good patient experience is also good physician experience, right? If you have a burnt out workforce, if you have a burnt out physician, there is no good patient experience. And so being mindful of how technology either hinders or harnesses the workforce is really critical to patient experience, is also an area that I'm focused on.
Well, I'm glad that you have been working in this space and focusing on it, because many of the people who you'll meet in Boston in September have been working in this space of patient experience. And sometimes, we forget that the consumer experience and all of these different health digital devices are impacting what happens when we do come to the clinic or when we do show up at the hospital, and that there's this whole world revolving together around these things. And I'd love to hear your perspective, Dr. G. Like, how do you see new technologies impacting patient experience today? Or, I think we might need to use the word consumer experience or person experience or human experience, because I think these new health technologies are impacting us all in whatever regard we're living.
Well, look, I think we've seen it. I mean, we continue to see it, right? We're living in a post-pandemic world where the consumer of today is hungry and thirsty for health information. And if they can get it from their doctor, if they have a doctor, great. But if not, they are certainly going to look for anyone and everyone that pretends to have the information. And so what do I mean by that? Well, number one, 59 million Americans turn to social media for information about their health and for healthcare decision making. When we look at the wearable market, it is a great indicator for how the consumer wants to understand their anatomy, their physiology, right? The wearable market went from a $32 billion market in 2019 to a $54 billion market in 2023, and it's only continuing to grow. And the consumer of today wants to measure their steps, their sleep, their mood, anything and everything. Even if they don't know what it means, they want to measure it because they feel empowered and they are hungry and thirsty for that information. And therein lies the opportunity, right? When we look at access issues, when we look at shortages, when we look at virtual care now just being everyday medicine, right? Hybrid healthcare is now everyday medicine. So I think there is no dearth of technology, but how we use them to really improve the patient experience is critical. But we also need to be mindful of those that are now in the healthcare market that weren't previously, right? Healthcare systems have often competed with other healthcare systems. Doctors have competed with other doctors, but now you're competing with influencers. Now you're competing with that home genetic kit that, promises to identify breast cancer. So maybe you don't need a mammogram, right? That's what the consumer thinks. And so for organizations operating in value-based care, for organizations who actually have true accountability to the patient, which oftentimes the consumer doesn't realize, right? You have any number of influencers out there, licensed or unlicensed, that will promise a lifestyle, promise some sort of product or service, but ultimately they're not accountable to how that impacts the consumer. And so I think we
Mhm.
have an opportunity in healthcare to flip that and really arise as the de facto expert, but also the accountable expert that will take care of you if what we say is not actually fruitful and doesn't actually
Mhm.
drive an outcome. And so I think we have to help the consumer of today navigate the myths and disinformation that is out there, because it appears to be consumer experience. It appears to be the right information, but oftentimes it's not the case. But the consumer is really latching on to what is relatable, reachable, and inspiring, and healthcare needs
Mhm.
to do a better job of that.
Yeah, I completely agree. And I think this is a good moment to invite you to clarify what you mean when you say misinformation, disinformation. And, people who are looking forward to reading your book, if they haven't already, are going to get a chance to dig into that more deeply in Dead Wrong. Tell us a little bit more about the differences between those things.
Sure. So the definitions, let's talk about the definitions, which can be a little confusing. So misinformation is actually just getting the facts wrong, right? Kind of like a rumor. So-and-so said something and you thought it was true and you passed it on or passed it forward or took some action based on that. Disinformation is actually more dangerous. Disinformation is actually the intentional manipulation of information or the facts to have some sort of personal gain, right? And that personal gain could be financial, it could be selling something, it could be political, it could be religious, it could be to subscribe or follow or somehow boost sort of your standing. But that's really the more dangerous thing, is this intentional
Mhm.
orchestrated propagation of disinformation. And in today's world, Laura, myths and disinformation are traveling 6 times faster than the facts, right?
Yeah.
Because of technology. Myths and disinformation have been around since the Black Plague. It's nothing new, but it's actually getting worse, right? Because
Mhm.
of the opportunities, because of the algorithms, because of AI, it is getting even easier to spread disinformation than ever before. And that's really the call to action in the book, and the call to action to healthcare, to say, this is a problem we have to solve. It's no longer just part of the wallpaper. We've somehow accepted it to be part of the wallpaper in which we practice. It's in the background. We don't think about it too much, but the truth is, it is becoming harder to focus on what the consumer needs to know and how to really affect their behaviors and outcomes amongst all of this noise.
What I hear is, you said a call to action. Like I feel we have a higher calling to step up as healthcare professionals, as leaders in the field, especially in the field of patient experience. Like we have to deliver information in a way that people want to receive it and in a way that they can understand it. And people who measure patient experience, Dr. G, are often looking at these very core questions like, how often did your provider explain things in a way you could understand? Well, you know what? Not often enough, in person or in the technology platform. So I think we really are called to action. And makes me wonder, like, what you're seeing from a strategy standpoint. Like, what strategies can we use to really leverage digital and tech to provide information, to provide health solutions that'll really improve experience for everybody? What are you seeing strategically?
Sure, you bet. And for those who do register and who do get the book, I really outline this in detail in chapter 8, and I use the use case of the Cleveland Clinic to talk about this. And really what it is, I'm calling you Laura, I should be calling you Dr. Cooley. Really what it is a team sport, right? What we can't take away is, oh gosh, it's another thing for the doctor to do, right? To become a social media expert. Definitely not what I'm promoting. What I am saying is that at the enterprise level, there is ownership at the top, right? Everyone from the chief marketing officer to the chief medical officer to the chief information officer, very similar to what the Cleveland Clinic did, which is to say, we have a trust problem, we have a loyalty problem. They talk about in the book about their issue with loyalty and trust in their local community, and how they partnered how the chief marketing officer went over to the chief medical officer and said, look, I need some doctors who will comb their hair. I'll tape them for 30 seconds or less. I want them to say what they always say in the doctor's office about your mammogram, your colonoscopy, whatever it might be. I'll take care of the marketing. I just want the doctors to be the doctors, right? And then Paul Mattson, chief marketing officer, went over to the CIO and said, what are the pipes? What are the technology pipes that I can use to put this information then out there? They penned a deal with YouTube. This was new at the time, right? Partnership with YouTube, Cleveland Clinic content, which now is like a top SEO search if you're looking for any medical content. And to the chief financial officer to say, look, one of the goals of this program is to drive patient acquisition, retention, brand loyalty. This is not just the right thing to do. It can make the organization money, right? So I think that's the biggest takeaway, Laura. And when I'm out there speaking, I will tell you that I always ask, who's in charge of the consumer experience, who's in charge of patient acquisition, retention, value-based care. And invariably a number of hands go up. But when I ask who is in charge of the mis and disinformation strategy at your organization, nobody's hand goes up, right? Because we have ignored it so much as part of the wallpaper and an afterthought. And I think in the world we're living in today, we have to realize that if our patients are taking a supplement or taking that home genetic kit and skipping the mammogram, it's a miss for us, right? Because in the end, those same patients end up in our ER. And at the end of every mis and disinformation train is a doctor, is a hospital cleaning up the mess, and the outcome is often worse. So the key is really prevention. And the other sort of nuance to this is that in healthcare, we've always thought of marketing as an afterthought. We've always thought of it as a nice to have, not a must have. And the reality is marketing is patient education today. And marketing is how you build your following. It's how you inspire brand loyalty. It's how you reach the consumer. And there's so much more competition for that in today's world where everyone seems to have a skincare routine. Everyone seems to have a weight loss plan, the key to longevity. I mean, you name it, there is, there is a biohack out there. And that's the new competition. And so we have to acknowledge that and really meet the moment.
Well, I'll give you a moment to take a drink. So many things you just said resonate for me, and I want to highlight a couple. One is that you talked about all the different players, stakeholders who are leading our healthcare infrastructures, right? So we're here to talk about patient experience. So we have people who may be designated to oversee that. And then we have people designated to oversee safety and marketing and like you said, patient acquisition and finance. And we all have all these leaders, but everybody is responsible for what I hear you talking about, which is leveraging our digital strategy and making sure that people are getting appropriate and useful information, not misinformation and disinformation. So how can we get people to work better together around this? Like what gets people motivated to come to the same table and have a more integrated strategy?
Well, look, it's ultimately about metrics, right? And at every organization, this really touches the bottom line. So when you look at the metrics, again, for the chief marketing officer, which is, again, going to be that brand loyalty, that support function to sales. When you look at the chief medical officer who has clinical metrics, how many people are bouncing back to the hospital, how many people are taking advantage of preventative screenings, measures, and the CFO who's responsible for patient acquisition and retention. They're all the same. They're all different names for the same thing, which is how do you get new patients, how do you get new consumers, and then how do you keep them, right? And how do you get them to take advantage of the products and the services that you offer? So that is ultimately all the functions of any hospital system, right? So those are the metrics. They're not new metrics. It's the understanding of how this strategy touches those and that we have new innovations and new competition in the market that we simply did not have before.
Yeah. And, a big part of the misinformation and disinformation concerns I hear you raising, it roots back to trust. And even though trust in our healthcare providers and our healthcare systems is probably at an all-time low, according to the latest data I reviewed, people do still trust their healthcare system or their doctor or whoever they go to. So I feel like we can leverage trust more. I'm curious to know your perspective about this. Like, how can healthcare providers build more trust with consumers, with patients in this tech-driven environment?
Sure. So, when we talk about trust, it's really interesting because when you ask consumers who they trust, believe it or not, 92% of all consumers trust their physician. But when you ask those same consumers how they feel about the healthcare system, they rate it as poor 52% of the time. And that's sort of an acknowledgement that while you might trust your doctor, right, you understand that your doctor has to actually work around the system in order to take care of you. The everyday consumer now understands that, particularly in a post-pandemic world. So if we think about trust, and when you ask marketers, how do you scale trust? There's a very simple model called know, like, trust for any brand. This is a very simple kind of roadmap for how you build trust. And the first one is know, which means the consumer has to know you. They have to be able to find you. And that's more than a website, right? That's more than a web presence. It means being able to find you on any aperture, any medium, social media, or otherwise. Secondly, they have to like you. And what does it mean to like you? Well, I'll tell you, one of the common questions I get when I drop my daughter off at school from many of the moms is, hey, Dr. G, before you leave, is there a female cardiologist you recommend? Is there a female GI doctor you recommend? There is an understanding that to like someone, we are looking for someone that looks like us, talks like us, might have the same cultural background. It is important because in healthcare, we deal with human stuff. We deal with some really intimate stuff. And there's an assumption that if we have something in common, I'll probably like you. You've walked a day in my shoes and I'll probably like you. So I'm looking for that. If I'm the consumer of healthcare, I'm looking to know you, but then I'm looking to, like, do I want to have coffee with you, right? And then the last one is trust. The last one is trust. And when you look at trust, this is the hardest one, right? What is trust? Trust is when I have a problem, I can call you, I have access to you, and you're going to pick up. And when you pick up immediately, you're also going to show up to the best of your ability to help me out. And history says we've done this before. When I've had a problem, you've shown up for me. When we work together, we get through it, right? When you look at healthcare, we fall down on almost every part of know, like, trust. No, yeah, for the most part, everyone has a website, and that's pretty much where it stops, right? i.e., we're not really investing a lot in marketing, as we talked about. When we look at, like, we have to do better at looking like our populations, looking like our constituents, making sure we look like the Black and brown and the underserved communities, particularly rural health, which we often forget about, right? 1 in 5 Americans are taken care of in rural America, but less than 10% of physicians even practice in rural America. So everything is harder if you are in rural America. And then lastly, look, when it comes to trust, I mean, depending where you are in the country, it can take 6 to 9 months to even get an appointment. So if you do have a problem, who are you calling? You can't even get someone on the phone, right? And even if you do get an appointment, chances are next time it's somebody else, or maybe next time it's a PA, maybe next time it's a nurse, maybe next time it's a doctor. Who knows? It's anyone's guess. And so there are a lot of infrastructure issues around know, like, trust that go way beyond just the technology. I mean, when we look at the physician shortage, we look at physician burnout, and this is why it's all connected. And this is why I always say we can't divorce patient experience from physician experience. Ultimately, we need both our clinicians and our care teams to be happy to make a happy, healthy patient. And we can't ignore all the stressors in the workforce that currently make it really hard to be a doctor in America.
Yeah, I'm glad you sort of landed in that spot, because I think, if I were a physician right now and I'm hearing you explain, like, all the dynamics of trust using that no model, like, that's a lot to hold. I have a lot to do. And for me, we talk about trust in healthcare a lot, but we almost have started talking about trust like it's like something you can buy. Like, I'll take a trust package, please. But, like, no, you have to earn trust. And earning things can be a lot of hard work, and it takes, like, dedication and investing. And so that's sort of what I'm hearing you say. I'm wondering what you think about my position on earning trust. And we're going to use that as a segue. We're going to hopefully earn some trust of the people who came to spend time with us today. by transitioning to discussions where they get to know each other a little bit better and share ideas. So we'll transition in a couple of minutes to those discussion groups. What do you think about this earning trust versus buying a trust package that I just pitched out there?
Well, look, if we could buy trust, it would be really simple. It's unfortunately just not that simple. That sounds like a hack to me, Laura. It's like, oh,
Right, I know.
Instagram, TikTok.
I think that's how people are talking about it. It scares me. They're like, we need to talk about trust. I'm, hey, you have to earn it. You can't just say, trust me. Like, you have to earn it.
And it's a relationship, and it takes time. It's not an instant, it's not a ramen noodle 60-second right dish. It's something that also takes time and has to be a priority and part of the culture, right? Part of the culture in any organization. It has to be embedded in that.
Absolutely. Well, I can't wait to have a deeper discussion with you in person in Boston, September 16th through the 18th, and also for people to get the gift of a free copy of your book for registering for that event. Let's wrap up our interview portion before we transition. What would you like to leave us with in terms of a parting thought as a patient experience community? What do you hope we go into our breakout discussions really thinking about?
Sure. Well, again, I think first and foremost, we've talked about patient experience for a long time. We've talked about consumer experience for a long time. I would like to send the reminder that, again, there is no patient experience without physician experience. So you have to look up the chain as well at the contributors to physician burnout, mis and disinformation being one of them, right? When a patient comes in and says, look, doc, I know exactly what I'm going to take or not going to take. The conversation is really hard to have once they've already drank the Kool-Aid on something else or been dissuaded from perhaps the gold standard. So I would just encourage dialogue on some of the bigger systemic issues and how there can be more partnerships on patient engagement strategies with physician engagement strategies. And lastly, I would say this is the most exciting time to be a healthcare leader. We're living in a post-pandemic world, ripe with innovation, ripe with a lot of attention at what worked and didn't work during the pandemic. And we shouldn't waste it. We shouldn't waste it. This is the time to go back to your organizations, propose things, be provocative, be ready to fail, but it is not time for the status quo. We have a real opportunity. It's a really historic time for us to do some amazing things in healthcare. And I hope all of you feel inspired to do so and come to the fall symposium and to meet in person and talk more about it. I'm really jazzed to be there with you, Laura.
Well, thank you so much.